Welcome, everyone. I see the attendees number is picking up. I'm just going to give everybody a moment to get in. Thank you so much for joining us. All right, wonderful. So, hello and welcome everyone to the Business of Being an Artist. This is the New Jersey State Arts Council's virtual professional development series. It's designed to cover an array of business-related topics for artists living or working in New Jersey. Today, our topic is Every New Jersey Artist Insured. This webinar will give you clear step-by-step guidance on what all your insurance options are and how to get the most affordable coverage to fit your needs in this changing landscape. During this webinar, you'll learn about Affordable Care Act plans, Medicaid, COBRA, and how to get discounted care if you're uninsured. This is an excellent opportunity for unbiased, comprehensive information from an experienced health insurance navigator who we will meet in just a moment. And we shared this as you registered, but just as a note, Medicare will not be covered in this webinar today. My name is Samantha Clark. My pronouns are she, her. I'm the Program Officer for Arts Education and Lifelong Learning at the New Jersey State Council on the Arts. I am joined by two colleagues today, Stephanie Nurbach. Stephanie will be helping me by dropping some links in the chat. You can contact either Steph or myself with any technical questions you may have during the course of the day. And Sally Vandewater has helped us plan our Business of Being an Artist series. She is also supporting us today behind the scenes. Thank you, Steph, and thank you, Sally. All of our information, including the Arts Council's website, will be in the chat in just a moment. So let's chat about the logistics of the day. Our presenter, who I will introduce, will speak for around 1 hour. The information will be presented via a webinar format. Following the presentation, we will have about a 15-minute Q&A, which means we might end a little bit early today. You are welcome to use the chat to share information and resources or to uplift important information you have heard throughout the presentation. The Q&A feature will be utilized for all questions. You are welcome to ask questions at any time using the Q&A feature, and we will be sure to ask our presenter during the Q&A portion of today's webinar. Questions placed in the chat may be missed, so please be sure to enter your question directly into the Q&A feature. Please note, today's presentation will be recorded by the New Jersey State Council on the Arts. To ensure privacy and to welcome questions, all questions, we will not be recording the Q&A portion of today's presentation. Please note, recording of today's presentation via AI, chatbots, or any other personal recording devices is strictly prohibited. So today's presenter is Jim Brokita. Jim is the Managing Director of Health Services at the Entertainment Community Fund. He's a the Entertainment Community Fund is a national human services organization that helps everyone who works in performing arts and entertainment. In addition to his work at the fund, Jim has been a working actor on Broadway, film, TV, commercials in New York for 35 years and beyond. He also serves as a trustee on the SAG-AFTRA health plan, as well as the SAG pension plan. He is a certified employee benefits specialist and is on the faculty of the Trustee Master's Program at the International Foundation of Employee Benefits Plan. My goodness, Jim, we are in good hands with you. I am going to go on mute and off video, and please feel free to take it away.
Thank you so much. And, really thank you to Samantha and Steph and Sally for their support on this. We're honored to be presenting to the New Jersey Council on the Arts today. This will be a presentation focused on, as Samantha said, focused on the Affordable Care Act and other options you may have at this point. Just by way of introduction, my name is Jim Brokita. As Samantha mentioned, I'm the Managing Director here of Health Services at the Entertainment Community Fund. We take care of everyone in entertainment, and I spent 35 years on the performing side. So let's get started. You can flip through the first couple of slides. You already introduced who we are as an agency. The Entertainment Community Fund is known as the Actors Fund for almost 100 years. We changed our name recently because we don't only deal with actors, we deal with everyone in the entertainment industry, musicians, technicians, stagehands, agents, ushers, anybody who's really in the entertainment business at all can come to us for services. You can go to the next slide. Um, in addition to health services, we do a whole bunch of other stuff. We do financial assistance, we do housing support, support for seniors, support for kids. We have a career center that does career counseling. So we run a nursing home in Englewood, New Jersey, the Actors Fund home in Englewood. So anything, if you need information about any of that, please feel free to contact us or visit our website. My team is the health services team. You see here we have our own webpage. It's listed there at the bottom, entertainmentcommunity.org/AHIRC. AHIRC stands for the Artists Health Insurance Resource Center. You don't really need to know that. But we deal with everything related to health and health services in the entertainment community. So in addition to marketplace webinars like this one, we do a weekly webinar on Medicare. Welcome to Medicare. We do Medicare counseling and marketplace counseling one-on-one to help people enroll in the Affordable Care Act coverages or Medicaid in New York, in New Jersey, and around the country. We have a team in California. We do have educational resources on our webpage, and we advocate for legislative change and support for health and health justice, especially for people in the entertainment community. You can go to the next slide. So our agenda today, what we're going to do first is I'm just going to go through some nomenclature just so we get terminology out of the way. Health insurance terms can be confusing. I just want to do a couple of slides on just vocabulary. And then we'll review some of the general principles of the Affordable Care Act and what is on a lot of people's minds, the changes that are coming from the federal government. The federal government made a big change in July, and that will be affecting coverages moving forward. And then we'll talk about the options you might have. I mean, I'm guessing you're here at the webinar because you've either lost your coverage or you may be losing your coverage or you don't have coverage or you want to know what to do if you lose your coverage. That's what we're going to be focusing on. And we'll talk about COBRA. We'll talk about whether you can purchase directly from an insurer, and then we'll go and do a deep dive into the marketplace. At the end, I have some resources if you remain uninsured for what to do about that. So you can go to the next slide. And so, like I said, the first thing we're going to do is just basic vocabulary. The words on this particular page all relate to, they're all terms that apply to health insurance policies, right? If you have health insurance, these are words you're going to run into. A premium, the premium is the amount you pay per month for the pleasure of having health insurance. That's what it is. It's just a fee you pay to the insurance company to have that policy. A deductible is the amount of money you are obligated to spend, the amount of money you're responsible for in medical services before your insurance plan starts paying anything. So if you have a $1,000 deductible in your health plan, the first $1,000 of medical services you're going to incur in a calendar year are going to be your responsibility. And then after that, the health plan will start to pick up costs. A copay is a flat fee that you pay at a doctor's office. So if you have a copay, you may pay $20, $25 at a doctor's office. Coinsurance is the one I think that throws everyone. Coinsurance, often expressed as a percentage in the documents you get from your health insurance company or on your EOB, your explanation of benefits, it'll be expressed as a percentage. Coinsurance is the percentage of the bill that you owe even after you meet your deductible. So if in the example before, if you have a $1,000 deductible, after that you go to the doctor's office and say you have a 40% coinsurance. And if the remaining bill, say your bill at the doctor's office was $1,100, right? So you pay the first 1,000 because that's the deductible. Of that $100 remaining, you're still responsible for $40, and the health plan will pick up $60. If you have a 40% coinsurance, it means the health plan's picking up 60% of the remaining cost. You're still responsible for some of the cost. People are surprised, I think, often by the amount of coinsurance they may owe. Out-of-pocket maximum, every plan, whether it's on or off the marketplace, has something called an out-of-pocket maximum. This is a number set by the federal government. It's, I think for 2025, it was $9,450 or $9,250. That's the maximum you would spend in a calendar year before the insurance plan has to pay 100% of all costs. You can go to the next slide. Um, the next slide has words that are really related to the Affordable Care Act marketplace. The federal poverty level is an income scale that's created by the federal government. It doesn't really have anything to do with poverty, although people say that the federal poverty level would mean that for an individual, if an individual in 2025 was making $15,650 or less, they would be considered impoverished. Although that's not really the way it's used by the government. It's used by the government as an incremental scale. So $15,650 is 100% of the federal poverty level. Benefits through the government are often tagged to that income scale. So you're eligible for Medicaid at 138% of the federal poverty level. You're eligible for different other benefits, SNAP benefits or housing benefits, if you're at 200 or 250% of the federal poverty level. So this is an income scale, and your income, when you go into the marketplace and apply for coverage, your income will be put on that scale, and they'll determine your eligibility. For 2025, the federal poverty level is set at $15,650 for an individual, $21,250 for a couple. I've used the word marketplace already. The marketplace has 100 different names. People call it all sorts of things. They call it the Affordable Care Act. They call it Obamacare. They call it healthcare.gov. It's all the same thing. In New Jersey, which is my home state, by the way, I didn't say that before. It's my home state. In New Jersey, it's called Get Covered New Jersey. The last term on this slide, the advanced premium tax credit, is the discount you can get off your monthly health plan premium based on your income when you get a policy on Get Covered New Jersey. So based on your income, you may get a discount off the price. That discount is called the advanced premium tax credit, and I'll say a little more about that as we get further into the slides. You can move ahead one slide. These terms, a lot of people are familiar with the first term. These are types of health plans, right? And they all say something about the network of doctors you use to get your services. So when you have a health plan, people consider doctors either in network or out of network, right? When a doctor accepts a certain insurance plan, they're said to be in network with that insurance plan. And depending on how the plan is designed or what kind of a plan you have, you may be obligated to use only in-network doctors, or you may have the opportunity to use both in and out-of-network doctors. And a couple of those types of plans are listed here. So an HMO, which is a health maintenance organization, in this kind of a plan, and all the plans on the New Jersey marketplace are HMO plans, by the way. In this kind of a plan, you must, actually, they're HMO and EPO plans. You must use doctors that are in the insurance company's network in order to get your services covered. You also, with an HMO plan, you also have to have a dedicated primary care physician in the network. And if you need to see a specialist or want to see a specialist, you have to get a referral from that primary care doctor in order to see a specialist. Some of the plans on Get Covered New Jersey, in fact, a lot of the plans on Get Covered New Jersey are that second type of plan, an EPO. EPO stands for Extended Provider Organization. These operate exactly like an HMO. In other words, you have to use in-network doctors to get the services covered, except you don't need that referral from a primary care doctor to see a specialist. So it gives you a little more flexibility. This can be very attractive to some people, right? Because you get an extra perk of not having to make that extra visit to the primary care physician. If you have coverage through your employer or through your union, you probably have what's called a PPO plan. A PPO plan gives you a great deal of flexibility and power. You can see pretty much any doctor you want. You save money if you stay in network, but you can see out-of-network doctors and get reimbursed at a certain level. Okay, we can move forward. So, general marketplace rules for 2026 on the Affordable Care Act. One of the great things about the Affordable Care Act is it's guaranteed issue insurance. You cannot be turned down for insurance on the Affordable Care Act. Also, there's no such thing as people being excluded for pre-existing conditions. This is a misconception on a lot of people's parts. They do not consider pre-existing conditions. It's guaranteed issue, and you don't have to disclose any medical information in order to get a policy. I'm going to skip to the bottom bullet point. All the plans on the Affordable Care Act cover preventive services for free. So this means annual wellness visits, any cancer screenings, vaccines, immunizations, STD and HIV testing, all that stuff is covered without cost. The dirty little secret about that is, somebody goes in for a cancer screening, and if they discover something, that preventive visit can turn into a diagnostic visit, and you may be on the hook for some costs, depending on how the visit goes. But generally, a preventive visit is covered without cost. Just that bullet point in the center of the page there. In a lot of states, there is no longer a tax penalty for being uninsured. New Jersey is not one of them. If you remain uninsured in New Jersey for more than 3 months, there is a tax penalty. The tax penalty, it's pretty significant, actually. It's 2.5% of a household income, or it can be a per person charge, whichever is higher. For 2025, the per person tax penalty was $695 for an adult and $347 for a child. California still has a tax penalty. New York no longer has a tax penalty. You can go to the next slide. Excuse me. All plans on the Affordable Care Act marketplace are mandated to cover a certain number of what are called essential health benefits. They are listed here. All of these things have to be covered by your policy. They don't have to be covered for free, but they have to be part of the policy and covered. Hospitalization, emergency room, you can see the list here. The asterisk at the bottom is just something we added about abortion coverage. Abortion coverage now depends on where you live and state law. In New Jersey and New York, abortion is a covered service under all the plans available on the marketplace or on New Jersey Family Care, which is the name for Medicaid in New Jersey. Go to the next slide. So, changes to expect from the federal legislation that happened in July. In July, Congress passed a bill called H.R. 1. It was also known as the Big Beautiful Bill. What's going to happen with this bill as it rolls forward in time is that it's going to make health insurance on the public marketplace anyway, harder to get, harder to keep, and more expensive. It's probably also going to make health insurance in employer coverage and union coverage more expensive as well, in my opinion. What they did with the bill was they front loaded a lot of the sort of sweeteners, so things like tax cuts and other sort of more generous or helpful things are in the first part of the bill, and they backloaded a lot of the more drastic changes, which won't be happening until 2027 or 2028, but they are slated to go into effect. So for right now, for people who are renewing their coverage or looking at coverage for 2026, the downside is that they're definitely going to be higher premiums, but a lot of the renewals will not be effective. In other words, you should be able to renew in the same way you've been able to renew in the past if you're currently on the marketplace. Higher earners, people over 400% of that federal poverty level, which I mentioned before, are going to be paying more for qualified health plans. Qualified health plans are the ones that are named after metals: bronze, silver, gold, platinum. The most serious changes immediately were focused on immigrant populations, including visa holders. We have a number of people in the arts who are on visas who are here. Maybe you can think of someone who's performing on Broadway or doing concerts or maybe shooting a movie. Artist visas are going to be, it's going to be harder to get a tax credit or a discount off the price of your plan if you're looking to get coverage. You can move to the next slide. Just year by year, what's going to happen going forward. So for 2026, the expanded tax credit, the expanded subsidy rates, right? So during the Biden administration, the Affordable Care Act extended the tax credits or discounts available to people at higher incomes. They made it more affordable, essentially, or gave bigger discounts, is more properly the way to think about it, for people to get coverage. Those rates are not going to be renewed as far as we can tell, although the government shutdown, which is happening right now, is focused on this very issue about whether these tax credits will be continued or discontinued. If they are discontinued, anyone making more than 400% of the federal poverty level, which for an individual is $62,600, and for a couple, let me just tell you what the couple rate is. For a couple, it's $84,600. For a family of four, it's $128,600. Anybody making over that amount will no longer get a discount off their premium. They're going to be paying full price. There's also going to be more stringent income documentation requirements. So it's going to be harder to, not harder, but it's going to be more likely that you might have to demonstrate that the income you're declaring on the application is actually your income, with either tax documents, check stubs, letters from your employer, et cetera. And in 2026, we're entering open enrollment right now. This open enrollment period is standard. Next year's open enrollment will be significantly shorter. Looking a little further ahead, 27, 28, people who are on Medicaid, we anticipate work requirements beginning in 2027. We don't know exactly who they will apply to just yet. It seems like they will apply to certain populations and not other populations, but it's unclear who's going to be required to meet those work requirements. The work requirements mean that you would have to work up to 80 hours a month, or volunteer 80 hours a month in order to retain your Medicaid coverage. States can apply for an extension for this until 2028. I know New York has already applied for an extension. I'm not sure about New Jersey, actually. I don't know. I'm expecting New Jersey will, but I don't know if they have already. Also, for Medicaid enrollees, there will be biannual certification, so you will have to certify your income twice a year rather than once a year. The practical effect of this is going to be, since it's going to be burdensome, it's going to shrink the Medicaid rolls. Okay, you can go to the next slide. So what to do if how do you prepare for this, right? What are strategies to use to make sure you stay covered and at the most reasonable or affordable the most reasonable and affordable way you can. The best thing to do is please pay attention to what's happening with your health insurance, right? Know when your coverage starts and ends. If you're on the marketplace, it's probably a calendar year, January to December. In New York, it's a floating sort of rolling calendar for different programs. Rely on us for accurate information. We'll always provide you at the Entertainment Community Fund with accurate information about what's happening in health. You can also meet with one of our health insurance counselors to figure out your options. You can always have a one-on-one consultation with us. We do get very, very busy during open enrollment, but between January and October, you can always get an appointment. Now it's a little harder to get an appointment. Other resources that you can use. Kaiser Family Foundation is an excellent news source, accurate, unbiased news source for health information. They're really good. They put out a lot of great stuff. We rely on them an awful lot. New York State of Health, which is the marketplace in New York, has a Stay Connected webpage, which is pretty good. Get Covered New Jersey has a page called Featured Updates. I went on a couple of days ago. It has not been updated, so I don't know. I don't know when it will be updated or if it will be updated with information about the federal changes. But there is a page dedicated to that on the Get Covered site, and I'm hoping they will keep people in New Jersey apprised of what's happening. Okay, so we can go forward. So right now, you came here because you're looking for information about insurance. What are your options, right? If you're covered, if you were covered, if you have coverage through a job or a union, or through your family, maybe you're turning 26, right? You'll be offered COBRA, and I'm going to talk about what COBRA is in a second. The second option you have is going to be to go directly to an insurance company and try to purchase a plan. We don't really recommend this. I'll tell you why in a second. And the third option is going on to the marketplace in New Jersey. And the marketplace encompasses Medicaid, so you can enroll in a marketplace plan, or if you're eligible in Medicaid. You can move to the next slide. Thanks for doing the slides, Samantha. I appreciate it. So COBRA. COBRA is, people think COBRA is insurance. COBRA is not insurance. COBRA is a law that says if your employer or your union coverage ends, you have the right to extend that coverage for up to 18 months. Sometimes you can do that for longer. It depends on the union or the employer. After you lose it, you can extend your coverage for up to 18 months. You have 60 days to opt into COBRA. So if your coverage is ending, for instance, tomorrow, October 31st, you would have all of November and all of December to decide whether you wanted to enter COBRA. Once you do that, you have 45 days to pay your premium and activate your COBRA, but you would have to back pay it to the day you lost the coverage. So you would owe from November 1st, you'd owe the full premium. The problem with COBRA is it is very, very expensive. Most people do not take COBRA because of the cost. I was just thinking of an example. For instance, Actors Equity Association, which is the union that deals with stage actors, their regular active coverage is $300 a quarter, so $100 a month. Their COBRA rate right now is about $1,140 per month. So it's a huge jump in cost. Screen Actors Guild announced that their COBRA rates for 2026 will be upwards of $1,200 per month for an individual. The reason that is because once you leave, as a union or as part of a union or an employer group, you're part of a group that buys insurance in bulk. Once you leave that group, you're no longer covered by that policy, that group coverage. You're an individual. And as an individual, from an insurance company perspective, your risk goes up. And when your risk goes up, your premium goes up. So that's COBRA. Next slide. The other thing you can do if COBRA isn't something you can afford or that you want to do or that you don't have access to, there's a couple of ways to go, right? You can call insurance companies and try to get them to sell you a policy. There are no PPO policies available in New Jersey or New York. You're not going to get them. People think that, oh, isn't there a way for me to buy a policy that's going to cover me while I'm traveling? In showbiz, people travel. We go on tour. We shoot movies or TV shows in different areas of the country. Can I get a policy that's going to cover me all over the country? The answer is no. You can try to get them to sell you a policy. I haven't done this in a while. The last time I did it was about a year and a half ago, and I got nowhere. You could call an insurer who offers policies on the Affordable Care Act. So in New Jersey, Horizon, CVS, Aetna, those, and they may sell you a policy. The problem is you're not going to get any discount based on your income if you're going directly to the insurer. They're only going to sell you a full price policy. And the options they're going to offer you as an individual purchasing from them are going to be much more limited. You're going to get more of a selection if you go on the marketplace. Also, if you're shopping, and I have another slide on this, but if you're shopping on the internet for insurance, please be careful. There's a great number of unsavory sellers out there promulgating what is purported to be insurance, and it's not. We call it junk insurance. Be careful. You can use an agent or a broker to get insurance. Agents and brokers, they're not bad people. I'm a licensed insurance agent in the state of New York. But they do have an incentive to sell you one policy over another because they're getting commission. They're working on commission. If you work with a navigator or what's called an assister, we are certified to give you accurate, objective advice, and then you make your own choice about what policy to get. You can find help in New Jersey at Get Covered New Jersey. You can go to the We Can Help and Find Local Assistance drop-down menu and find assisters or navigators in your area. Okay, next slide. So this is what I said a minute ago, right? The prices are going to go up so much in 2026 that people are going to be tempted to remain uninsured, or they're going to be tempted to buy junk insurance policies online. Short-term plans, sometimes these are framed as short-term plans, or sometimes they're called meta-share plans. They're faith-based organizations will sell them, or community organizations will sell them. It's not always nefarious, but the business model is not strong enough to sustain an insurance company. And so they don't take enough in premiums. They can't pay claims. There are horror stories about companies going bankrupt, people having to pay their own bills. It's awful, really. Short-term plans are illegal in New Jersey. They're illegal in New York and the other states that are listed there. You may see a cheap price, but these are unregulated products, right? So please, if you're going to go down this road, please read what you're buying. Some red flags. I've seen all of these things. We charge a membership fee. We're not really major medical. I saw one the other day that actually said on it, on the policy, it said, this is not insurance. So please read what they send you and don't be tempted by cheap prices, because if it's, in this case, if it looks too good to be true, it's going to be too good to be true. Unsavory sellers will become more common as the ACA rules are relaxed. I think that's a really true statement. Okay, so moving forward, you can change the slide. We're going to talk about the marketplace. This is the front page of the Get Covered New Jersey marketplace, where you'll if you're on this page, you're on the correct page. If you can go to the next slide, I think I have a picture of the New Jersey Family Care homepage. New Jersey Family Care is the agency in New Jersey that deals with Medicaid and also the child health insurance program, or sometimes called CHIP. New Jersey Family Care, I probably will have a slide on this, or we'll say this later. New Jersey Family Care is not as efficient as you hope it would be. It takes a long time to get eligibility determinations. They are an under-resourced and understaffed organization, and it's difficult sometimes to communicate or deal with them. Although once you're in the pool and you have the coverage, it can be quite good. Okay, move forward. Thank you. So the marketplace, how does it work? If you're going on Get Covered New Jersey, right, you're going to submit an application. And the system is going to look at they look at a whole bunch of things, but they're going to look at two specific things about you. The first thing they're going to look at is what's called the size of your household, by which they don't really mean that. What they really mean is the way you file taxes. So you may be a single with no dependents, or married filing jointly. Often the size of your household mirrors your tax filing status. And then they're going to look at your income. So right now we're looking at incomes for 2025 starting next month, and especially after the 15th of November, we're going to be looking at incomes for 2026, right? We're going to be projecting incomes forward for 2026. Once it knows these two things, it puts them together and it puts you on a scale, that federal poverty level scale that we talked about before. They put you on a scale, and depending on where you fall on that scale, you may be eligible for certain programs like Medicaid, or you may be eligible for a discount off the price of your monthly premium. Next slide. The marketplace will determine your eligibility. So you're going to fill out the application, you're going to put in your income, and it's going to tell you whether you fall into the Medicaid bucket or you fall into what's called the qualified health plan bucket. Qualified health plan, as I said, are the ones that are named after metals: bronze, silver, gold. I think it's only bronze. It's only bronze, silver, gold in New Jersey. New York has platinum, but New Jersey has 3 levels. And if you're in a qualified health plan, you may get a qualified health plan with a discount, or you may be paying full price without any financial assistance. If they determine you eligible for Medicaid on the Get Covered site, they transfer your application over to New Jersey Family Care, and I don't really know where it goes. It goes to New Jersey Family Care, that's for sure, but it's sort of, it can take you a number of weeks before you hear back from New Jersey Family Care about your determination. Once you do hear back, the coverage will backdate to when you applied, but be patient. If you're eligible for Medicaid, you may not get an answer right away. In New York, it's an immediate determination. In New Jersey, it can be, 45 to 60 days, sometimes more. Next slide. When can you do this? Open enrollment, going to start in a couple of days. Open enrollment in New Jersey starts November 1st. So between November 1st and January 31st, anyone can go into the system and purchase insurance. You don't need a special reason. You can go in and get insurance at that time of year or renew your insurance. Other states that are using the federal website, which is healthcare.gov, it's a little shorter, November 1st to January 15th. Next year, it will be significantly shorter. I don't know the dates yet, but it's going to probably mirror the Medicare open enrollment, which runs from like October 15th to December 7th. It's going to be a much shorter window of time. Again, the practical effect of that is people will miss the enrollment period and not get coverage. Outside of open enrollment, you need a reason to get insurance. You need a special reason. Sometimes they're called qualifying events or qualifying life events in order to enter the system. If you go on the next slide, I have a list of the qualifying life events. These are things that open up what are called special enrollment periods, right? If you lose your coverage, you lose your employer or union coverage, or something happens in your life, you get married, you have a baby, you move, even if you move counties, you move from Essex to Bergen or something like that. You're turning 26 and you're aging out of your family's policy, or you have a change in your immigration status. All of these things open special enrollment periods. Once those things happen, you have a 60-day window to find, shop for, and enroll in new insurance. Next slide. Other exceptions, aside from the special enrollment periods. If you're eligible for Medicaid, you can enroll any time of year. You also can put a child on the child health insurance program any time of year. There's no restrictions on those two things. New Jersey, right now, it's October 30th, right now has what's called a low income special enrollment period. So if your income is below, in New Jersey, 200% of the federal poverty level, you can enroll in coverage any time of year. That low income special enrollment period is going away in 2026. This is because of the changes in the federal law. People who are lower than 200% of the federal poverty level, if they're lower than 138%, they can get Medicaid, but this is not going to be a special, you'll have to have something else happen in your life, not just an income change. Next slide. If you need help applying or enrolling, right, we do one-on-one consultations here. That's our website. You can register for our portal. You have to get a username and password and request an appointment with one of our benefit counselors. We do handle New Jersey. We're certified in New York, but we can guide people through the New Jersey application. You can also get help from Get Covered New Jersey. They're actually pretty good. The reps at Get Covered New Jersey. New Jersey Family Care, they have enrollers as well, although I think the marketplace is probably a stronger option. If you're in a state other than New Jersey, or if you're spending time in a different state that uses a federal website, you can find assistance at the healthcare.gov link. Can you go to the next slide? If you're going to apply on your own, excuse me, make sure you have all your documentation ready before you get in there, right? You want all your personal information, the name and address of all your employers, your tax filing status, an income estimate for 2026, any immigration documents. You want all of that stuff with you when you go in so you can complete the application accurately. Next slide. Calculating income. So this is always a hard one for people in the entertainment industry, right? Or anybody who works in sporadic freelance employment that works for multiple employers. How do I predict? I don't know what my income is going to be in 2026. There's a couple of ways to do this. This first way, I put this here, although it's not as clear on the New Jersey application as it is on the New York application. You can sometimes use your last year's tax return as a guideline, right? What did you make last year? Is it going to be the same? Can you use that adjusted gross income number? You may be able to estimate an income within 10 or 15% of that adjusted gross to get your eligibility for next year. Little harder to do on New Jersey because they're asking for specific types of income that you're going to be earning in 2026, jobs, unemployment, dividends, interest, things like this. You have to enter them. But if you're in the range, if you're in a similar range to last year, they may give you your eligibility without asking for extra documentation. So sometimes you can use that last tax return as a guideline. Next slide. You will be listing, though, especially this is really true for the New Jersey application, income you know is coming, guaranteed income, not potential income, right? Well, I might shoot a movie, well, I might record an album, well, my book, I might have my book done, and I might get publishing royalties. You're going to deal with guaranteed income. So W-2 income, net self-employed income, right? And any other sources of taxable income that are coming into your house. So somebody rents an apartment from you, or you're going to sell your house and get a capital gain. You know, those are the sorts of income that you're going to have to declare on this application. Gifts or family money under $18,000, you do not have to declare on the application. Next slide. Medicaid. So just a little about Medicaid. Medicaid, called New Jersey Family Care in New Jersey. It is comprehensive health insurance at no cost. There's no premium, there's no deductible, there's no cost sharing of any kind. Sometimes there's a very small, like $1 to $3 copay for certain prescriptions, but it's effectively free coverage. It runs for 12 months. If your income changes while you're on Medicaid, right now anyway, if your income is changing, you can stay on Medicaid. Nobody's throwing you off Medicaid before your 12 months are up. The reason I say right now is because as we move forward with the changes in the federal law, there may be biannual certifications. You may have to prove your income more frequently. That's going to result in changes in status if your income changes. In most states, including New Jersey, you can apply right through the marketplace. As I said, you fill out your marketplace application. If you're eligible, or they think you're eligible for Medicaid, they'll shuttle you over to New Jersey Family Care. If you know or think you may be eligible directly for Medicaid, you can apply through the New Jersey Family Care website. Medicaid is accepted in all hospitals, right? Most urgent cares. The problem with Medicaid is access. Not all doctors in their private practices accept Medicaid. So if you're on a Medicaid plan and you have an insurance company, maybe you have Horizon or whoever it is, you have to use doctors in that insurance company's network to get the Medicaid services covered. Next slide. Two ways to be eligible for Medicaid, annual and monthly, right? So annual, your annual income, this is 138% of the federal poverty level. Right now, that'll, I guess it'll change next year. It's not going to change before the end of this year. For an individual, that eligibility threshold is $21,597. For a couple, it's $29,187. Or what they'll do is once you enter your income in the application, they'll generate a monthly income for you. They'll take your income, divide it by 12, and get a monthly amount. If your income is below the monthly income limit for Medicaid, you'll also be eligible. The monthly income limit right now is $1,800 for an individual, $2,433 for a couple. And this gives you Medicaid for the 12 months, regardless of what your income is for the rest of the year. If that calculation winds up to be where it is, you'll get the Medicaid eligibility. In New Jersey, immigrant adults have to have legal permanent residence status for at least 5 years to be eligible for New Jersey Medicaid. I think that's still the case. I didn't check that for 2026. I don't know. The only thing that'll happen, it might get more restrictive, not less. It's not going to get less restrictive. Next slide. As I said, you can apply through the marketplace or through New Jersey Family Care at their websites. You can also check your application status, which you'll have to do if you're sent over to New Jersey Family Care. You'll have to be responsible for checking on your application status. There's a telephone number here you can use to do that. It's also on their website. Next slide. If you're not eligible for Medicaid, your income is above that 138% FPL, you're going to be eligible for what's called a qualified health plan, a bronze, silver, gold plan. Costs for these plans are going to vary by your household size, the type of plan you choose, the insurance company, the county you're in. And depending on your income, you may be eligible for a discount. The discount is called an advanced premium tax credit, and that will lower the cost of your premium. Next slide. The discount that you get based on your income. You have to be married filing jointly in order to get, if you're married, you have to be married filing jointly in order to get it. The way to think about this discount, because there's a tax implication to this discount. You have to think about it the way the government thinks of it, right? You're going to tell them on that application how much you're going to make for 2026. And based on what you tell them, they're going to give you a discount off the monthly price. So let's say I'm going to tell them I'm going to make $45,000 and they're going to give me a discount of $200 based on that, what I told them, $45,000. Next year, when I file my taxes, if I actually made $45,000, the government is very, very happy because they gave me an appropriate discount based on the income I told them. But if I go back next year, or when I file my taxes next year, I made $145,000, government's going to come to me and say, Jimmy, you told us $45,000. We gave you all this money. Now you made $145,000. You're going to owe some of that money back to us. That's the risk of the tax credit. You need to be accurate when you estimate your income, because they're going to base the discount based on what you're going to base the income on what you tell them. And then if your income shifts and goes higher, you may owe some of that credit back. Just want to make sure people understand that. It took me a long time to understand that when I first got to this job, and the penny didn't drop for months on this, but now I understand it pretty directly. Next slide. There is a way to estimate your discount on the Get Covered site. I took some screenshots. They're not perfect. I'm sorry, they're a little hard to read. But when you go in there, you can put your zip code, right? I put a Passaic County zip code here. I just chose a random birthday, and I chose an income of $40,000 you see in that last box, right? So if you fill in a couple of these data points, and if you go to the next slide, Samantha, you'll see that based on those data points, Passaic County, the birthday that was in 1999, and $40,000, the estimated discount I was going to get was $247 a month from the federal government and an additional $100 from the state of New Jersey. So the total discount for me in that situation, in that scenario, would be $347. You pay the full premium minus $347. That $347 gets paid directly by the federal government and the state to the insurance company. You're responsible for the balance. You can go to the next slide. This is just a slide showing the different levels of coverage. Bronze, silver, gold, and platinum is on here. Don't get roped into thinking that like bronze is the worst and platinum is the best or gold is the best. That's not really the way it works. What happens is it's the cost sharing that's different, right? So bronze and silver plans have lower monthly premiums, but they have higher costs on the back end when you're getting care. So bronze plans are the cheapest per month, but they have very, very high deductibles, and everything goes against the deductible. So you wind up paying out of pocket for a lot of your care until you reach your deductible. Next slide. Sorry, I have a few. I know we're getting close. When you're choosing an insurance company, how do you choose an insurance company? You get in here, you get your eligibility. Name brand isn't necessarily better. People gravitate toward like, Blue Cross Blue Shield or, something they've heard of. It's not that really. The decision factors on choosing a plan really come down to two things. Budget, how much can you afford per month for health plan premiums, and how you're using the health system, right? Are you generally healthy and you see a doctor once or twice a year, or are you managing more serious things where you need to see certain doctors? Because where your doctors are in network is going to become critical to choosing your plan, right? If your plan is very expensive and your doctors don't take it, it's not worth anything. If it's very cheap but your doctor accepts it, it's kind of a golden ticket. Also, take a look at silver plans. Silver plans on all marketplaces across the country generally give you kind of more bang for your buck. They'll add certain services or discounts or copay only services to the design of the plan that make them a little more favorable. So I would always take a look at silver, even if you're going to wind up buying a bronze. I would just look at the silver and see what's available on the silver. Look at the details of the plan. Next slide. These are the insurance that'll be on the marketplace for 2026. Aetna CVS, AmeriHealth, Horizon Blue Cross Blue Shield, Oscar, United, and WellCare. A couple of cautions. I noticed AmeriHealth did this year. I don't know if the others are doing it. You have to stay in network, right? But they have tiers of network. So it depends on if your doctor is like tier one AmeriHealth, you pay one price, and if it's tier two, you pay a much higher price. It's very hard to tell that on the Get Covered New Jersey website. It's also hard to tell that from the doctor's office. So this leaves consumers in a very unfavorable position, actually. But be aware that there are these kind of, uh, I don't know what they are. It's to me, it's not a good practice that they're putting these things in there, tiers of coverage. It seems kind of nefarious to me, but they're insurance companies. Next slide. If you're uninsured still after all of this, right, there are ways to get care. There's a website called essentialhospitals.org. These show all the public hospitals in the country. There's also a website called Needy Meds. That's the second one. Needy Meds is really focused on prescription drugs, but they do publish a list of low-cost sliding scale and free medical, dental, and mental health clinics all around the country. So say you have a policy in New Jersey, but you're in, Idaho or something doing a play, you can go and type your address in and try to find a place to land since you're uninsured in that area. I want to say one more thing about the in-network only, in-state only thing. If you get a policy in New Jersey, it will cover you for emergencies if you're out of state, but it has to be a true emergency. It can't be routine care. Gets a little squishy if you think like, well, I have COVID or I sprained my ankle. I don't know whether those things will be covered. If you're having a heart attack, you'll be covered. In New York, there's a couple of resources here that are specific to New York. Sorry about that, but these are two resources for uninsured and immigrant populations, NYC Care and New York City Health and Hospitals, if you happen to be in New York and you need care. Next slide. On prescriptions, if you remain uninsured, even if you are insured sometimes, these resources can be good to get cheaper versions of your drugs. Needy Meds and GoodRx. A lot of people know GoodRx. It shows you the sort of price of your prescription drug at different pharmacies or places in your area. There's another one called Single Care that has a pretty good comparison tool. A really interesting one is Cost Plus Drugs. Cost Plus Drugs was a site that was started a few years ago by this Shark Tank guy on television, Mark Cuban. But what they do, they don't deal with insurance at all, right? They buy directly from the manufacturer. They add a little markup to the drug, hence the name Cost Plus, and they sell it directly to consumers. They have about 3,500 to 4,000 drugs on the site at this point. Always wise to check the cost of your drug on that site. You have to have a prescription, of course, for the drug, which means you have to see a doctor to get a prescription. But if you have a prescription, there's ways to get the drug a lot cheaper on that site. And that bottom one, that Needy Meds, that's that list of medical clinics. If you can pop that in the check, that's a good link as well. Next slide. Thanks for popping those in the chat. That'll be great. This is a comparison of one drug. I think I did it twice. It's Single Care and then at Cost Plus. So this is a drug called Lexapro. You can see the pharmacies on the left, the retail price, and then the discount price you'll get with Single Care depending on which pharmacy you go to. So if you went to on this list, excuse me, what is it? Kroger. If you go to Kroger, it's the cheapest one in your area. Next slide, please. And this is the interface for Cost Plus. So again, this is Lexapro, and you would be able to buy it, whatever that is, at the 5 milligram tablet for $27.86. I don't know how many you get in that. It doesn't show on the screenshot, but it's certainly a good thing to check if you're looking to discount or get a discount off your drug coverage. Next slide, please. We in New York, we have the Entertainment Community Fund runs a clinic called the Friedman Health Center for the Performing Arts. We do take all the union coverages. So if you're covered by an entertainment union health plan, we accept your coverage. We also take Medicare. We take a number of marketplace plans, but they're New York marketplace plans. We have 4 primary care doctors. We have a sports medicine doctor actually starting November 11th. We have a podiatrist on staff. We're adding a gynecologist in March, and we have referrals to ENT and orthopedics. We're right here in Times Square, 49th and 7th. And if you go to the next slide, I think I have for people in the entertainment industry. If you're in the entertainment industry and can demonstrate earnings in the entertainment industry, we do provide subsidized visits. Office or telehealth visits would be $40 each, and the lab work is donated by a company called BioReference. So if you're in the business and you need primary care, you need a sick visit, this may be a way to go if you're uninsured. Next slide. We also got a donation this year from an actor named Tova Felcha. She donated a pot of money to pay for early detection of ovarian and other reproductive cancers. So if you're uninsured and you're in the industry and you have industry income of at least $3,000 in each of 3 of the last 5 years, you can get free cancer screenings and OBGYN visits here at the. I think that might be it. That's it. That's the presentation. So I did go just a little under an hour. But thank you for joining, and I'm happy to answer any questions. I'm gonna just turn that light off that went on in my office.
Jim, thank you so much. I started slacking on moving the slides forward because I was so interested in the information you were.
I was going too fast.
No, I was so into the information. I learned so much. We have some questions in the Q&A. And to all of our participants, thank you for joining us. Please pop any question in the Q&A so that way we can answer it live. I'm going to stop.
So you did a great job. Thank you so much for doing it.
You got it. And thanks, Steph, for popping those slides in the chat. I'm going to stop recording.